Hello, my name is Dr. Christopher Carpenter. I am an optometrist and I practice here in Arizona. So I own two practices. There's 5 doctors in our group, and I spend my time seeing patients between the 2 offices, but I also oversee a lot of the day-to-day operations. There's a lot of administrative duties that I have as well. And I was asked to talk to you today about how my duties and my patient encounters have been affected by HIPAA, what we call HIPAA. Now, HIPAA comes under the Department of Health and Human Services, and I think you've already learned a fair amount about this branch of the government, or this department within the federal government. We also call this the Health Department for short. And their job is just to look out for the overall well-being as citizens of the U.S. They want to make sure that we're healthy. They want to make sure that we're protected. And like many government programs, it's very well-meaning, and they have an important function, but also they tend to get very big, and it can affect our lives in a lot of different ways. But the Health Department, like I say, is interested in to make sure that we have access to health care. They're interested in immunizations, making sure our children have access to the health care they need as they grow so that they develop properly. They provide education for the public about different type of health topics and things that are important going on. Well, a few years ago, a big law was signed in. In fact, I'll read a little bit of this introduction to HIPAA. So this is our HIPAA binder. So this nice thick binder has to do with HIPAA. And HIPAA, I'll tell you what it is. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. It was signed into law by President Clinton back in '96. It is the most sweeping legislation to affect the healthcare industry in over 30 years and is comprised of 2 major legislative actions: health insurance reform and administrative simplification. So as you look at the date there, this is many years, probably 14, 15 years before Obamacare. So, Obamacare, of course, has come out since and has changed a lot about healthcare. However, still HIPAA remains, and I'll talk to you specifically about how HIPAA does affect us. But basically, the purpose of HIPAA is twofold. Number one, to improve the efficiency and the effectiveness of healthcare and reduce the cost of exchanging health-related information through standardization of all shared electronic information. So basically that means make it easier. Now that most practices, we have all of our medical records on the computer, the government recognizes that the computer can be a great resource in storing but also sharing health information. But at the same time, they want to make it standardized so it makes it easy for me to communicate with other healthcare providers. And they're also very worried about the privacy of the patient's information. You don't want patients' information out there where they could be a victim of identity theft. But also, health information is very sensitive, and patients don't want their employers, they don't want their peers, they don't want others maybe knowing all of the details of their medical information. And so this helps with that. And then along those lines, it also protects the privacy and the security of patient information stored and exchanged electronically. It also protects personal health information that is not electronic. Now, I'm sure all of you have been affected by HIPAA. When you go into any doctor's office, usually you will sign a form, and a lot of times it's called a HIPAA form, or it might be a confidentiality form, but basically a patient will sign it saying that they understand what their rights are, and they understand that that doctor's office is not going to share or export their health information without their express written consent. It'll also even talk about on here, it may ask, hey, who in your family can we share your medical information with? Like if you have a lab test, will you give us permission to leave a message on your phone, the results of the test? Or can we leave a message with your spouse and things like that? And so you can opt to do that, or you can opt to keep it private. The other thing that you'll often see is a medical release form. Oftentimes, we have patients referred to us from other professionals, or we're going to refer those patients for further care to a different specialist. Our patients have to sign this form saying that we have permission to go ahead and share that information with somebody else. So that's just a brief summary of how HIPAA affects us, but as you can see, this whole binder is our office plan as to how we're supposed to administer HIPAA and help keep patients' information private. As a general rule, you just have to be careful that you don't leave personal information out and about where others can see. I want to take you back now to one of our exam rooms and just show you a couple other things. So if we come right this way. Okay. So we're coming back to an exam room. Now, our patient records are electronic, but while the patient is in the office, they do have this little card that we just write with erasable marker that just has some pertinent information about them, and then when we're done with the exam and everything's in the computer, this gets erased. But ever since HIPAA came out, we make sure that we always either store these face down on a desk, or we always have them turned around backwards in these card holders so that that information is protected. And then, as we come into the exam room here, the other thing we had to do is, since all of the medical records are on the computer, we can't leave that open because we'll leave patients in here while they're waiting to see the doctor, and we don't want them in here on the computer rummaging through their information or other people's information. So every time a technician comes in here, they have to sit down and they log in with their username and password, and it brings up that medical record. And then when that technician is done, they log back out. When the doctor comes in, we log in with our own login, and then we log out. So that creates a digital trail as to who is in the chart when, and it makes sure that nobody can access those records unless they're authorized. And our employees also have to sign HIPAA forms saying that they will not share confidential patient information. We have to remind our employees that what happens in the office in their interchange with patients has to stay in the office. They can't take that elsewhere or share any of those things. Just a brief experience I wanted to share with you. My uncle was an optometrist, and before I was out of school, he shared an experience he had where he had a patient who was a dentist, and this dentist apparently had very crummy eyesight, and he wore specialty contact lenses so that he can see. So he came in for his eye exam, and they ordered some new contact lenses for him, and they came back rather quickly. And so my uncle's front desk staff called the receptionist at the dentist office to let her know that the dentist's contact lenses were in. And the staff members said something like this, said, hey, just want you to know that Dr. So-and-so's contacts are in. They came back really quick, and so we wanted to let you know so that he can come by and get them, and because we know his vision's really bad without them. And just said something like that. Well, a few days later, that dentist came back and sought out my uncle, and he was very upset. And basically he was upset that comment was made, basically saying, hey, the staff has no business in knowing that I wear contacts or how bad my prescription is. You know, that needs to be kept confidential. And he was absolutely right. You know, that confidentiality is important. But it just shows how innocent little comments can get out and leak sensitive information that people don't necessarily want out there. So those are all things that we're affected by and we need to keep in mind. What's our time?
9 minutes, 50 seconds.
All right. I'm told that my time is up. I was going to just start reading through that 3-ring binder page by page, but I'll go ahead and sign out since our time is up. But hopefully that helps you understand a little bit more about HIPAA and how it affects a medical practice just in our everyday duties. Okay? Go Cougars.